Ladies and gentlemen, thank you for standing by and welcome to today's webinar for applicants submitting full proposals under the Foundation for a Healthy Kentucky's Investing in Kentucky's Future initiative. We encourage you to submit questions via the chat feature, whether joining us by streaming the audio over your computer or by phone throughout the webinar. Questions will be addressed at the end of the webinar as time allows. Today, we are joined by Susan Spida, President and CEO of the Foundation for a Healthy Kentucky. Welcome, Susan.
Thanks very much, and welcome to everybody who's here on the call this afternoon. We'd like to congratulate you, first off, for getting to this point and this day. It was a very competitive process with 52 letters of intent received from all over the state that resulted in 22 invited applicants, and that's all of you on this call. There will be a further selection process that consists of reviewing the written materials that you present to us and also site visits conducted in the early spring before the proposals are taken to the board in May. And we will be funding somewhere between 5 and 10 grantees. The purpose of our call today is to make sure that we are clarifying your expectations and that we're on the same page together. This may not be a grant initiative that works for everybody, and hopefully by the end of today's call you'll have the answers you need to decide if this program is a good fit for your community. So I do encourage you to ask questions both through the chat room, and I'll be picking those up as I see them, and then at the end there'll be time for voice questions if you prefer to have a conversation that way. The purpose, as you know, of Investing in Kentucky's Future is to encourage community stakeholders from many different walks of life to get together and work collaboratively so that children in your community have a better chance of growing up healthy. Very specifically, children 5 to 18 years old have a chance of not contracting those chronic diseases that are a challenge for our generation, so that they will grow up healthier. Now, we understand that when you work with kids who are 5 to 18, you're working with their family, you're working with the various environments that they interact with during the day. Our board, in deciding to do this initiative, said very clearly that this is not coordinated school health. For those of you who know Foundation for a Healthy Kentucky, you know we had a multi-year coordinated school health initiative. That may turn out to be part of the right answer for your community, or your community may want to take what they're doing in an entirely different direction. We recognize and believe that for children to grow up healthy, many aspects of their environment need to be encouraging them or prompting them to make healthy choices, to learn a lifestyle of being healthy, and to be in an environment that supports that lifestyle. If you are successful in getting a grant as a result of this process, the first period of funding will be for a planning period. And I say a planning period rather than a planning year because those of you on the call are at all different places in terms of your own local processes of assessing the needs of your community and coming together as a coalition working for positive community change. So it may take a different amount of time in each community, and we have the latitude to work with you if it takes 6 months, if it takes 12 months, if it takes 18 months, to move from understanding what the challenges are in your community and the resources are in your community to one very smart thing that you and the people in your coalition believe you could do that would make your community a healthier place for children to grow up in. In philanthropy, we throw around a lot of terms, and so part of what we're trying to do in this call is be as transparent as we can be about what we're doing and what we're saying. We talk about this initiative being a place-based initiative, and we'll hit on that a little later in the conversation as well. But the belief is, as we've said before, Dr. Gil Friedel was on our Community Advisory Committee for many years, and he's always said, if the problem is in the community, chances are the solution is in the community. So when we say a place-based initiative, we think of place as smaller than Kentucky. We think of it as a geographic area whose members would define themselves as being of that community. So we anticipated that the typical size would be a county. If you have two very small counties who collaborate on lots and lots of things, you may have two counties working together at the table. If you have a very large county with a large population, you may actually select a neighborhood to work in. You may select that before you submit the full proposal, or you may use the process of that first planning period to decide which is the community with the greatest need, where you can do the greatest good by doing this work. And that brings us to the concept of health equity. Part of what you're trying to do in getting this grant and doing this work is to make the chances of children in your community fairer, more equitable. If a particular neighborhood is known to be sicker and poorer and have less opportunity for education than another community, then shoring up that challenged community helps to address the health disparities in your community and helps to improve health equity. Often when we talk about health equity, we look through a racial or ethnic lens, and that is not necessarily the case in this proposal. It may be. You may have a community that you work with who are particularly challenged, and in addition to the challenges of education and lack of jobs and poor housing and a challenging environment, they also happen to be a community of color. That's entirely appropriate to address that and to work with that community, and of course have members of the community that are impacted as part of the planning team and part of the planning process. We talk about business plan development, and this is a little bit different from a typical nonprofit strategic planning process. There are some key elements of it that might be the same, first and foremost being what's sometimes called an environmental scan, looking at what's in your community, what the strengths are, what the challenges are, who are already working on helping children be healthier, and what is it that you can bring by either bringing them to your table or by filling a gap that they have been unable to address. And you still could bring them to your table to help address that gap. But the end product of this planning period is not just a description of the needs and resources of your community, but it's a very specific business plan to do one bold thing that you think will make your community healthier. If you have a banker on your team, it'll be very helpful so that you can develop what's sometimes called a financial pro forma. You look at the costs of year 1, year 2, year 3, and you gain an understanding of when your project is going to break even and be able to sustain itself. And that's something also that's somewhat different about the Foundation's investment in Kentucky's future, because some funders invest in what we call buy grant making, which means if you're doing something right now and you're doing it very well, they want to buy into it and help you do some more of it. We're investing in what we call build grant making, which means that you're going to go from 0 to 60. You're going to build on what you have in your community and do something new in a way that you know you could sustain if you could get past that costly startup period. We want to take on some of the risks of that startup period if you're confident after you've done your business plan and your financial pro forma that you would be able to sustain this project going forward. Not by getting another grant from the Foundation, although we are prepared to work with you for as long as 5 years to get your sea legs and get you on an even keel so that you are sustainable. So business plan development is something different in this initiative. Our next slide has a whole slew of terms, and we'll just jump in. Sustainability has to do with what we've just been talking about, that you have the confidence once this program or project is launched, and it could be a grocery store providing fresh fruits and vegetables, it could be a school-based clinic, it could be a many kinds of things. We don't want to limit you by suggesting, because there are as many answers as there are communities on the call. But what you need to be certain of is that with the revenue that you gain from the project itself, from community stakeholders who stepped forward and made a multi-year commitment because they see the value in this continuing in your community, and with the occasional, perhaps, golf tournament or other fundraiser to fill a modest gap, you would be able to keep this project going, this program going, for children in your community for as long as it's needed. Why do I need partners? Again, because we believe that the smart answers in your community will come from getting many different viewpoints and many voices at the table. It's going to be helpful to have those different perspectives. You may be accustomed to, for example, if you're a hospital, doing a community benefit plan and then marshaling your own forces within the hospital to go ahead and implement that plan. If you've been a health department that's accustomed to engaging the community to help you design your map, but then as the county health department take on the responsibility for carrying it out, this may be a new and unaccustomed role for you to share that leadership and share that decision-making about what the right project will be and how it will go forward. The nice thing about partners is partners come with ideas, partners come with sweat equity, and some partners even come with money. If you haven't invited your local United Way to the table, or if you have a community foundation and your community approached them about being engaged, or if you have philanthropic, we sometimes refer to them as high net worth families in your community that might have a great interest in having children in your community grow up healthier, it's important to reach out to them and see if they have an appetite for helping strengthen the health of children in your community. What does it mean to work at the policy or the system or the environmental level? The Foundation for a Healthy Kentucky, by its Articles of Incorporation and the founding documents, is precluded from providing ongoing operating investments in worthy programs around the state. Instead, our founders believed that we needed to work at the policy level to make enduring change in systems of care. So in your community, what does that mean? Perhaps what you want to do is to make sure that children don't start smoking. And so you may design a project that includes 24/7 smoke-free campus. That's a policy decision. You may get your whole community, if it hasn't already, to go smoke-free. That's a policy decision that changes the environment in which those children are growing up. And for their parents, you may want to make it easier to get smoking cessation. And you may want to develop programming that deals with the obesity that sometimes accompanies a decision to stop smoking. So those are policy decisions. Systems decisions may be that when you look at the system of care in your community, you discover that there's an important piece missing for the kids. Maybe they don't have access to dental care. And so you may want to create a systemic change working with the healthcare providers in your community to integrate oral health care into the care that is available through perhaps a primary care clinic or a pediatrician's office or a school-based program to make sure that you have a system of health care for kids. Working on the environmental level, you may find that there are challenges to being physically active in your community, as simple as the fact that there's no safe place to play. There aren't bike lanes to bicycle from one place to another. There aren't sidewalks or other safe designations that make it easy and safe to walk in your community. Those would be environmental level changes that might improve the health of children going forward. Perhaps you have an even bigger challenge. You may have environmental pollutants that are triggering asthma in children in your community, and again precluding their physical activity out of doors. So there may be both policy and environmental solutions that you would work to address. Once you figure out what the biggest health issues of concern are for your community, We then say we'd like you to undertake promising or evidence-based practices. And we want to be a link to evidence-based practices, promising practices. That's just jargon, if you will, to distinguish ones where there's a very strong basis of evidence in study after study that suggests this approach works very well for children, versus one that just suggests there hasn't been a lot of data yet, but it certainly seems like it works, and we want to invest in exploring that a little further. That would be a promising practice. We can help be the glue between you and other foundation-funded efforts, other CDC-funded efforts, and various banks of evidence-based methodologies for approaching the health needs of children. And we don't have all the answers, but we would like to be a broker and help your community find those answers. You don't have to have those answers going into the full proposal, but you will need that answer to develop your business plan before the end of phase one. Developing your coalition or diversifying the one you have, and that's very important, because if you already have a wonderful coalition who've been working together for years, making really positive health change in your community, keep them at the table. You don't need to push them aside in favor of a brand new and improved coalition. But do look at who's at the table and see if there's some partners who are missing. And we strongly encourage you to reach out to them. In fact, we require commitments from a number of cross-sector key community leaders as a part of the application process. As those of you who got the award letter or the congratulations letter know that each of those community partners is going to have to let you know how they're going to be at the table. Are they going to be devoting staff time to this effort? Are they going to be giving you office space? Are they going to be putting money in a bucket to help support the effort? They're going to need to get very specific about what it is that they're supporting. And frankly, that was an important distinction between those of you who are on the call and many who didn't make it on the call, who simply had nice letters that said, "Bravo, we think this is a really fine organization and we sure hope you fund them." That's not what we're looking for. We're looking for how they intend to work with you over the years ahead to cause children to be healthier in your community. When they come to the table, try and get a sense of whether they're going to be with you for the planning period, whether they're more interested in the startup, or whether they're with you for the long haul. And frankly, you may not know that when they're signing those letters of support to get the proposal in the door in February. That may come out later in the planning process. When we come out to site visit you and your coalition, we're going to want to understand how the coalition makes decisions, because that helps us understand whether this is really a broad-based community engagement effort or if it's just people sitting around giving advice to one person who is then has all the burden of the work on his or her shoulders. We're needing to understand who calls the meetings, how you decide when a meeting gets called, and who follows up on the commitments that are being made. That comes from our awareness that a long-term systemic change effort really requires somebody to be the backbone for that effort over the long haul. Somebody who everyone's aware of, who calls them together, cajoles them into doing the work, and we'll want to understand where you are in that process. I've talked about demonstrating that you have engaged community leaders, talked a little bit about defining community, and I won't repeat what I've said here. If you think it's a community, if people in your community would say, "Oh yes, I live in name of community, I work in name of community," then chances are you've got a community. When you send your proposal in, your full proposal that's due February 28th, we'll be looking for evidence that you have an awareness of your community's health challenges. You're going to get a deeper awareness during the planning period. But if you do cite data, and we hope you do, please let us know the source of it, when the study was done, if it's a study, who it was done by, anything you can give us to help us understand where that information comes from. Also, to understand further what you've signed on for, every grant the foundation makes is not just a check. It's also an opportunity for training and technical assistance. And that'll be starting with the January 16th workshop for applicants, where we'll be bringing in some experts from within Kentucky and the nation to help us think together about what community health change really means. And we hope that's beneficial to you, whether you are among the 5 to 10 final grantees or whether your community goes off on its own to do this good work for children's health. Because we understand that the people who've responded to this proposal aren't just doing it because there's money. They're doing it because they have a passion for kids. And the training and technical assistance will be available to you as a grantee or as a prospective grantee. I've talked a little bit about the fact that this is build money. This is money that transfers the startup risk from your community to the foundation. It is not a source of ongoing support for a program or project that has no other visible means of support. We'll offer help linking to promising practices, and we'll offer evaluation assistance. We will be funding an external evaluation team that will work with you and work with you to figure out what data are going to be needed to evaluate the entire initiative. You'll have a role in designing that if you're one of the accepted applicants. We'll be looking for folks to report their information using the CDC's Community Commons website. And we've just gotten word from Kaiser Permanente this morning that chna.org has also gone live, at least in its Beta 2.0 launch. This is nested within the Community Commons website, and it's a learning resource, a web-based utility that we hope is going to be helpful to assist hospitals and community-based organizations and local health departments and even financial institutions that engage citizens who want to map out the needs and assets of their community. So chna.org is a new online resource to help with your efforts. And we'll keep linking you with other sources of data and information. We'll also be asking you, if you are among the selected applicants, to tell us success stories, because we understand the success of your project is not just data. It's people's lives being transformed. And we'll be providing you with a format to use in telling those stories so that we can take a megaphone to them and share your good work more broadly. But we want you to understand as you take this effort on that ultimately the community is at risk for continuing the services. We are helping with a startup, and you and all the folks around your table are taking on the commitment or the burden of making sure that the gains you experience in the years we work together are sustained for the long haul. There are many resources already in play in your communities. KentuckyHealthFacts.org is the website the Foundation has created that has health data. Your hospital that serves your community is probably in the throes of community benefit planning because of the new IRS reporting requirements, and they make a wonderful partner. Your health department may be going through a process called Mobilizing for Action through Planning and Partnerships, or MAP, as a stepping stone to accreditation, and that's also a wonderful foundation to build on, as well as simply the shared experience of the people you bring around the table. You know best, they know best. So it's data and stories and lives lived in your community that will help you move forward to smart answers. What is success in phase one of this effort? We hope it will give you time to plan, help you identify willing and capable partners, help you shape clear and feasible goals for your program, and launch a process for lasting change in your community with ways to measure your success and modify your work if you aren't getting the success that you hope to get. But we hope that you will use this opportunity to build for the long haul. This is not just get 10 people around the table who haven't been around the table before to pull down some money and then they all go home when the money disappears. Hopefully these are neighbors and colleagues who will be with you for the long haul. And I apologize if you're already there and I'm saying something obvious. If so, congratulations. Again, this process Investing in Kentucky's Future is not for everyone. It's not a way to fund MAP and then you're done. It's not an offset for recent cuts in Medicaid and state funding in the lowered tax base that we're all experiencing. I understand some of you are having trouble with the audio, and hopefully you've gotten a hint from Chrissy that'll make that work better for you. And it's also not a way to fund a permanent new position in your school, health department, hospital, or statewide advocacy effort. Now, you may fund that permanent new position, but the foundation's funding will go away. So be aware, again, the thought is it's for startup costs, transition costs, bringing people together, but the long-term funding in year 7 and 8 and 9 and 10 of that new position would need to be baked into the solution that your community arrives at. Again, so what it is, I've said what it's not. What it is, it's a source of skill training, information sharing for your community's leaders who are dedicated to positive health change for children, and it's a way to share the startup risks for your innovative new strategy for growing healthier kids with the Foundation for a Healthy Kentucky. A little bit on what to look forward on the training on January 16th. Weather permitting, that's going to be here in Louisville at 9300 Shelbyville Road. If you haven't already sent in the names of the 2 people from your team who will be at that training, please do send them to szapeda at healthy-ky.org. You'll see my email a little bit later in the presentation. We're going to get some local and national experts to talk about building a strong coalition and making that coalition an agent for local change. Have an opportunity to assess your capacity for financial stewardship if that's something that's new to you, and talk a little bit more about what that business plan thing looks like, and how to move from planning to action for children's health. We're also going to have some folks help us look a little bit about how communities make positive change. We're in conversations right now with MESA and with the Prevention Institute to be the source of trainers for that January 16 session and give you access to them. Also, this is the time to tell us if there's something else you'd like to learn that seems fairly mysterious about the Investing in Kentucky's Future initiative. Not to belabor it, it's not, and maybe this is our ego talking, it's not just another grant. It's a different way of working with communities to offer you an opportunity to build on the strengths you already have and to try out something that you may not have had the resources to try out and see if it will help make children in your community healthier. So, okay, Carlos, at this point I'm ready to open it up for questions from anyone who has them.
All right, thank you. Ladies and gentlemen, if you would like to register a question, please press the 1 followed by the 4 on your telephone. You will hear a 3-tone prompt to acknowledge your request. If your question has been answered and you would like to withdraw your registration, please press the 1 followed by the 3. One moment, please, for the first question. Once again, to queue up for a question, please press 1-4 on your telephone keypad.
Okay, if there are no questions.
I'm sorry, ma'am, we do have a question now. It's on the line of Laura Patrick. Please go ahead.
Yes, in the RFP, you talk about a match from funding from your community. What is the ratio for that match, and is it cash, in kind? Could you?
Okay, there's no match requirement in Phase 1, but in Phase 2, it will be a mix of cash and in kind, and that can vary from community to community depending on what the project is that you undertake. Match may come in the form of land in a building. To start a new program, match may come in the form of an ongoing commitment of cash to underwrite the cost of a position. It may come in the form of equipment being purchased or donated. But there will be some element of it will be cash, but we don't have a hard and fast mix at this juncture.
Okay, thank you.
Thank you.
Once again, to queue up for a question, please press 1-4. We appear to have no questions on the phone line, ma'am.
Okay, well, on your screen you should see my email address, szapeda@healthy-ky.org. If you and your team get together after this call and you think of something you wish you'd asked, just shoot me a question and I will answer it as promptly as I can. Thanks so much. Have a great holiday season. And again, congratulations and thank you for your willingness to invest in making the children of your community healthier. Have a good holiday and a good new year. Bye now.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your lines.